Crazy about benne masala dosa. Wow. And anything you want in a personal favor, please take her to eat masala dosa. She'll do anything for you. She's that kind of a person. Please welcome the confident, smiling young therapist who believes that healing with a compassion touch is...
Thank you, Flavian, for that. So, Craniosacral Therapy. So, how did I really reach here? Well, this is me in 3 pictures, my life till date. So, what really happened for me to reach this place is Arnold-Chiari malformation, a disorder that sounds vague again. I was born with it. It's basically your skull being small and brain being normal sized. So, you have a hell lot of things to go through with it. And Craniosacral therapy was ultimately the thing that worked for me. And hence, here I come down to tell you what I did. So, this is my 2-year diploma certificate that I finished 2 years back, 2.5. And this is a specialization course on mothers, babies and children's, basically working with pregnancy and the relationship of what you hold with your mother and how that can have an effect in later life, and also be able to treat children, that is, you know, young 2 months, 3 months, 3 years old children. And this is a specialization in just blood, and this is a specialization in breathing, how breathing can alone have an effect in your life. And this is studying the face in depth, because face is, after all, the only projection to the outside world of who you are. So, studying that in full depth. So, this is an article that was published about me in New Zealand and Australia as the youngest therapist in the world, and who graduated youngest and still practicing young. So, this is an article that was published 2 years ago. So, coming back to what craniosacral therapy is, what does this term really mean? So, cranio is basically the skull, or the cranium as such that we call the head, and sacrum is the last bone of the spine. So, everything that comes in between this is what we work with. This is one place we can access the whole body. So, you know, this is called craniosacral therapy. So, what do we do with accessing the body? We work with the health. How many of us really know what health is, even if we use it every day, talk so much about healthy, unhealthy? What is health? So, there are so many aspects to it. So, there is an emotional aspect to be, you know, able to, you know, talk positive, to feel positive. Spiritual health, our belief system that we tend to believe and how that has an effect on us. Physical health, to be physically in good condition. Social health, to be able to relate to people in the right way, otherwise, you know, you get stuck. And mental or intellectual health is the ability to, you know, accept reality in life and move on. Otherwise, you know, there is a hell lot of psychological issues we could really go through. So, how do we do all this in a therapy session? Well, we do it with a touch, as simple as that. So, why so? Why is touch so simple? Touch can be to give life, isn't it? That's the first thing that children really seek when they're born, and hence we work with it. So, giving you a few facts about what touch and why touch is so important. It's the first experience we gain when we are conceived in the womb, and the last sensation to lose before we die. Isn't it special? This is one of those things that is developed even before our thinking brain or cognitive brain was developed. And so, working with the primitives of where we are coming from, we are working with the touch. And touch also signifies a lot of compassion, safety, love, affection. Who wouldn't want to feel all this, right? Well, that's what we do. So, what do I do with all of this as a practitioner? I'm listening. I'm listening to your story, the story that your body has to tell me. I'm trusting the body's ability to heal itself. Well, isn't that great? How many of us really do it? I'm acknowledging whatever you're going through as a person till date. I'm accepting you for who you are, so we are not making any judgment here. And we are present to you fully. How many of us in this room just now is present to whatever I'm saying? A part of you is thinking for what's up for breakfast. You know, oh, I have to make a call to my client after I go. Oh, I just forgot to give something to my husband or daughter. How many of us is just here? So, well, in a therapy session, we are 200% with you, and that's what makes it special. And so many times we're doing so much in our lives that we get stuck. So, you know, to undo things is so important. So, we practice non-doing as a way of healing. So, these are a few pictures of us treating children. This is called intraoral work, and also, yes. So, coming down, we touch, right? That's what I was talking. So, what do we touch? We touch into the skin. And what is the skin made of? It's a projection of the nervous system after all. And what is the nervous system? The nervous system is the whole body, in fact. So do you get a connection of what we're really touching into and how we do this? So there's a direct connection to how we're working. So just giving you an example of what happens in a demo session, I'm going to be doing a demo and telling you about how a typical session for 40 minutes to 1 hour in my clinic would be. So asking Hemlata to be my yes for today. So yeah. So all you have to do as a client is lie down, and I will be, yes, you can lie down. Thank you for that. So we start off sessions by treating your leg. The body is seeking. It could be the spine or the head. So I'm just showing you this to give you an idea of how a treatment session is. So there is no massage, there is no pressure, there is no manipulation. So it's just like this. So there's nothing that the client has to do. So it's just going to be that or that or that. So nothing else. So thank you, Hemlata, for that. So how many of you all really have questions of, is this safe for you to refer anybody? So who could take this? Do you think there's anybody who cannot take this? Even the person in their last breath or going through the worst condition, anybody could. It's so simple and easy. So, you know, a few questions that people often have, is this Reiki or pranic healing? After all that I've said, I don't think any of you all have that question. We're more body therapists. We work with what you're made of or what is within you and not outside energies or nature. And hence that makes us different. So how many times do I need to see you is a question that most often everybody have to ask us. So well, I would say pain is one of the last symptoms that is going to come up or show in any disorder. And it's the first thing that would disappear when you're worked upon. And hence there's a lot that needs to be addressed in between it, so there is no reoccurrence. And hence you'll need to see me. And we believe that slow is fast in a policy that's so, you know, it's really addressed to. So what are the conditions does it work? So I definitely talk about it. So is it a quick process? I think I just addressed that question too. So I'm just giving you an idea of what happens when you see me. So this is how a balanced body can look, and this is how an imbalanced body can look. So imagine a client comes to me for a knee issue. It could be right up to your shoulders, pelvis, or your your ankle. That could be the reason for your knee pain, and hence if you just, you might not even realize it's coming from there, right? So, you know, we really need to address the roots, and that's what makes us special. Not just addressing that part of it, but also everything that is associated with it. So, this is a list of issues that really work for craniosacral therapy, which you can read up later. I'll leave this slide. So, this is a testimonial that a few of my clients have written for me. And so gives and asks. So I would like to say one thing, that I work with individuals and not companies. So I'm still trying to find a way of how I can bring more referrals to the chapter in spite of working with individuals, and hence I would ask your excuse for today. And I would like to ask one thing from each of you all is, there is something that I think you all would have recognized in yourselves that can be worked upon, or your immediate family. So I think have the patience to see me at least 3 times once a week. Have the patience, be open and trust the process, and do come and see me. That's what I can ask you for today. And I would say take care of your body, buddy. It's the only place you have to live in after all. So, you know, book your appointments with me. I'm always here. Thank you.